Hello, my name is Kayla Mundy. I am currently a nursing student at Vincennes University Jasper. I am also currently in a microbiology class. Both of those have given me information about various diseases of the body, including those of thrush. I also have done some research on the CDC website and Mayo Clinic website that have given me some accurate medical knowledge on this disease. So what would you do if you woke up and looked in the mirror and saw this? Big white patches all over your tongue, some pain when you swallow, and some redness. These are all signs and symptoms of thrush, and some people with this infection do wake up with this pain. So a little background about thrush. Candidiasis is a fungal infection caused by a yeast in the mouth. That fungus is Candida, and it is all over the skin without causing any disease. So we typically have this in our cheeks, on the roof of our mouth, on our tongue, and in the back of our throat occasionally. So all of this just stays in our mouth day in and day out. However, a minor change in any of those environments in our body can cause an infection to begin. So this infection looks like some white patches in the back, as you can see here. The super reddened throat area are also some big signs, and it can be pretty painful for those patients. So some common characteristics are, again, those white patches in the mouth, as you can see in this picture here. It kind of spreads throughout the outer portion of the tongue, and it can get pretty thick and pretty severe. Since it's so thick at times, it can cause a cotton-like feeling in the mouth. You can also lose taste since you can't get those taste buds through the fungus. There can also be pain with eating and swallowing, and some redness and soreness either in the mouth or, if it's more severe, down the back of the throat. So there are some things that put you at a higher risk of getting thrush. Some of those include a compromised immune system. Those patients would be patients with diabetes, cancer patients, patients living with HIV and AIDS. Due to their compromised immune system, they aren't able to fight off infection as easy. Therefore, just that small change in environment for this fungus allows it to grow so fast without them being able to fight it off before it gets so severe. The same with smokers. The more you smoke and get smoke in your mouth and down your throat when you're inhaling it into your lungs, changes that environment in your body, causing that fungus to grow. Also, babies 1 month or younger, they have lived as a fetus in their mother, getting their mother's immune system, and once they are about a month or a little less than that, they're still building their immune system outside in the world full of germs. Therefore, getting any infection, including thrush, is a lot easier for them. Certain medications that cause dry mouth can also make you more susceptible, along with poor dental hygiene. If you don't have a healthy, wet mouth, those infections are able to grow a lot easier. Same goes for dentures. It's very easy for bacteria and fungus to grow in that sort of environment if you don't clean it properly and let it air dry also. So focusing in on those patients with HIV and AIDS, the CDC says about 1/3 of those patients with advanced HIV infections have thrush. So knowing that and being an HIV and AIDS patient, they should be more aware and more cognizant of their mouth health, their throat, ensuring that there's no dry mouth, just knowing that their compromised immune system can put them at a higher risk. It's also easier for them to have this infection spread down the back of their throat due to them not being able to fight much off with their immune system. So as you can see here, those white patches in the back of the throat can get pretty thick for patients like this. So there are ways that you can prevent thrush. One of those being just really good oral hygiene, making sure that you brush your teeth twice a day, floss, even scraping your tongue can help. Also, making sure you get those clear fluids every day are also really beneficial. Also, rinsing your mouth after those inhaled medications, making sure that you don't get the dry mouth or that film from the inhaled medications. Also, getting a good toothbrush and toothpaste regimen and making sure you throw out your toothbrush whenever it gets infected is also really important. So there are treatment plans for thrush. Obviously, since it's a fungal infection, antifungal medications is the route that we typically take. There are multiple routes that you can do. If it's really severe, you can do an IV, but typically it's just an oral medication. It could be in tablets or liquids, depending on age. Liquids are best for children, but tablets are available, and it's also just preference. There are also some common medications used that just your run-of-the-mill thrush. Those first lines of defense there would be nystatin, miconazole, and clotrimazole. Those are the basic ones, but obviously there's always more severe cases that require a tougher medicine, a more potent medicine. People such as those immunocompromised people like the HIV and AIDS patients, those with diabetes, or even those just with allergies to these medicines. There is a severe medication called fluconazole, and that tends to really knock it out, especially if it's the more severe version of thrush. Also, with those little babies that we talked about with being at a higher risk, it's very easy for them to spread thrush on their binkies or on their mother's nipples whenever they're breastfeeding. So there are antifungal creams for breastfeeding mothers that are available to try to rid that thrush on their body. Also, just disinfecting any potential carriers. Like I said earlier, the toothbrush and the dentures seem to harbor a lot of bacteria if not cleaned well or disposed of properly. Also, practicing that good oral hygiene. Like I said from before, mouthwash, ensuring everything's nice and clean, even flossing really nicely to make sure that we get in between those teeth and get everywhere that we can. So in conclusion, thrush can be as horrible and painful as this first picture here where it's really thick and calloused on, or it can just be some redness in a few spots, but just knowing the signs and symptoms and how to treat them are really beneficial for treating this infection.